Hi everyone, welcome back to our high yield step 1 review. Today we'll be talking about pathology. Like always, we'll be going over some high yield vignettes. Take a second to pause the video to try to guess the answer. And don't forget to subscribe to our channel, share the video with your friends, and like this video. So let's get started. If you need some additional practice questions, I've partnered with TrueLearn to give you a $25 off discount using the code SUCCESS25, and I'll have the link in the description box below. Okay, so first we're going to be talking about some important pathology concepts. So the first one is what we call an increase in the size of cells. For example, hypertension causing left ventricular hypertrophy. So this is hypertrophy. Next, we have an increase in the number of cells, for example, an elder male with BPH. This is hyperplasia. Now we have a decrease in size from degradation from the ubiquitin proteasome pathway. An example of this is poor nutrition. This is atrophy. And now we have something when cells change from one cell type to another cell type. An example of this is Barrett's esophagus when the cells change from squamous to columnar. This is metaplasia. The next one is disordered cell growth, and this can be precancerous. This is dysplasia. Now we'll be talking about different types of necrosis. So the first type is where we have ischemia and infarcts in all organs except for the brain. This is coagulative necrosis. Next, we have necrosis that happens in the brain or abscesses, and neutrophils are involved. This is liquefactive necrosis. The next type of necrosis is what we see in tuberculosis, histoplasma, nocardia, and macrophages are involved. This is caseous necrosis. The next one is where we see it in polyarteritis nodosa, hypertensive emergency, and preeclampsia. This is fibrinoid necrosis. The next one happens in the distal extremities and the GI tract. This is gangrenous necrosis. Now this is a type of infarct in organs with multiple blood supplies like the liver, lung, intestine, and testes. This is a red infarct. We compare that to the next one, which is a type of infarct in organs with a single blood supply, such as the heart, kidneys, and spleen. This is a pale infarct. Now we're changing gears. The next condition is where we see hair loss, nausea, and vomiting after radiation exposure. This is acute radiation syndrome. Next, we have skin thickening, lymphedema, pulmonary fibrosis after radiation exposure. This is radiation-induced fibrosis. The next one's a little bit different. We're going to see what all of these types of cancers have in common. Papillary thyroid cancer, angiosarcoma, myelodysplastic syndromes, osteosarcoma, breast, ovarian, and lung cancer. This is radiation-related malignancies. Next, we have calcium deposits in diseased tissues, normal calcium levels, and examples are TB, psammoma bodies, and plaques. This is dystrophic calcification. The next one is calcium in normal tissues. It's widespread. Patients will have elevated calcium, and examples include primary hyperparathyroidism, sarcoidosis, and chronic kidney disease. This is metastatic calcification. Next, we have yellow-brown wear and tear pigment associated with normal aging. This is lipofuscin. Next, we have deposits seen on Congo red stain, apple green birefringence, can involve the heart, liver, kidneys. We have AL in multiple myeloma, SAA in chronic inflammation, beta 2 microglobulin in ESRD, and ATTR in familial syndrome. This is amyloidosis. Next, we have infection inflammation with elevated ferritin, fibrinogen, hepcidin, haptoglobin, procalcitonin, C-reactive protein, and decreased albumin and transferrin. This is acute phase reactants. Now we'll be talking about the four main steps of leukocyte extravasation. So the first one involves selectin and sialolysis. This is rolling. The next step involves CD18 and integrins. This is adhesion. The next one involves PCAM CD31. This is diapedesis. The next step involves C5a, IL-8, LTB4, and PAF. This is migration. Now we'll see which factors are involved in the following processes. So FGF and VEGF. These are involved in angiogenesis. The next one is metalloproteinases. This is remodeling. The next one involves IFN gamma, macrophage activation, and the patient can present with fever, cough, and night sweats. This is granuloma formation. And remember, the patient presentation here oftentimes is a TB patient, which is why I mentioned the fever, cough, and night sweats. The next one is a scar that extends beyond the borders of the wound, and we have excess TGF-beta. This is a keloid. The next one involves abnormal cells that have invaded the basement membrane using metalloproteinases and loss of E-cadherin. This is an invasive carcinoma. Next, we have spread of the malignant cells and multiple nodules seen in various organs. This is metastasis. Next, we have the most common cancer in men. This is prostate cancer. Next, we have the most common cancer in women. This is breast cancer. Next, we want to find out the cancer that causes the most deaths. This is lung cancer. Next, we have tumors that commonly spread to the brain. This is lung and breast cancer. Next, we have tumors that commonly spread to the liver. This is colon, stomach, and pancreas cancers. Next, we have tumors that commonly spread to bone. This is prostate and breast cancer. Next, we're going to be mentioning the mutations, and I want you to guess what cancer they're associated with. So HER2. This is breast cancer. Next is RET. This is MEN2A, MEN2B, pheochromocytoma, medullary, and papillary thyroid cancers. The next is BCR-ABL. This is CML and ALL. Next, we have BRAF. This is melanoma. Remember, that's the hyperpigmented area on the skin that has irregular borders. Next, we have c-KIT. This is the GIST tumor. Next, we have c-MYC. This is Burkitt lymphoma. Then we have N-MYC. This is neuroblastoma. Then we have KRAS. This is colon, lung, and pancreas tumors. Then we have BCL2. This is follicular and diffuse large B-cell lymphoma. The next one is APC. This is familial adenomatous polyposis colorectal cancer. This is the hereditary one where the patients have lots and lots of polyps in the colon. Next is BRCA1 and BRCA2. This is breast and ovarian cancers. Next, we have DCC. This is colorectal cancer. Next, we have MEN1. This is MEN1 syndrome. Next, we have NF1 and NF2. This is neurofibromatosis 1 for NF1 and neurofibromatosis 2 for NF2. And just a little review, remember MEN1 syndrome is the one with the pituitary adenoma, parathyroid hyperplasia, and then the pancreatic tumors. NF1, that's where we get all those fleshy nodules over the skin, the Lish nodules. And then NF2 is the one with the bilateral acoustic neuromas. Okay, next we have an RB mutation. This is retinoblastoma and osteosarcoma. Next we have TP53 mutation. This is Li-Fraumeni syndrome where we have sarcomas, breast carcinomas, leukemia, and adrenal tumors. Next we have TSC. This is tuberous sclerosis. Then we have VHL. This is von Hippel-Lindau. And then we have WT1. This is Wilms tumor. To recap some high yield points for some of these important syndromes, remember in tuberous sclerosis, this is the one where you can get the angiomyolipomas, the ash leaf spots, and the shade-green patches on the skin. In von Hippel-Lindau, you get the pheochromocytomas, the renal cell carcinoma, and the hemangioblastomas. And then remember in Wilms tumor, it's usually the younger patients who present with a kidney tumor. Okay, the next one are going to be cancers associated with these risk factors. So aflatoxin. This is associated with hepatocellular carcinoma. The next risk factors are going to be dyes, tobacco, and naphthylamine. This is transitional cell bladder cancer. The next is arsenic and vinyl chloride. This is liver angiosarcoma. Next is asbestos. This is bronchogenic and mesothelioma. Remember, bronchogenic carcinoma is more common with asbestos exposure. Okay, tobacco. Okay, so there's a bunch. Smoking is associated with so many types of cancers. Renal cell carcinoma, pancreatic cancer, squamous cell carcinoma of the cervix, esophagus, larynx, lung, and transitional cell bladder cancer. So keep all of those in mind if you have a smoker with any of these features of these cancers, like weight loss and fatigue and some imaging finding. Next, we have nitrosamines in smoked foods. This is stomach cancer. Next, we have HHV8. This is Kaposi sarcoma. Next, we have HPV 16 and 18. This is cervical, penile, anal, and head and neck cancers. Next, we have HTLV1. This is adult T cell cancer. Next, we have H. pylori. This is gastric adenocarcinoma and malt lymphoma. Next, we have the liver fluke. This is cholangiocarcinoma. Now we have schistosoma hematobium. This is squamous cell bladder cancer. Remember, we want to compare that to smoking, for example, which causes a transitional cell bladder cancer. Next, we're going to be talking about tumor markers. So if we see an elevated alkaline phosphatase, which cancer are you going to be thinking of? This is metastasis to the bone or liver, or also it can be Paget's or a seminoma. Next, we have elevated AFP. This is hepatocellular carcinoma, yolk sac tumor, or a neural tube defect. Next, we have HCG. This is hydatidform mole, choriocarcinoma, or testicular cancer. Next, we have CA19-9. This is pancreatic cancer. Next is CA125. This is ovarian cancer. Now we have calcitonin. This is medullary thyroid cancer. Now we have chromogranin, synaptophysin, and NSE. This is neuroendocrine tumors like small cell lung cancer, neuroblastoma, and carcinoid tumor. Now we have an elevated PSA. This is prostate cancer. Next we have S100. This is a melanoma. Now we have TRAP. This is hairy cell leukemia. Now we have GFAP. This is astrocytoma and glioblastoma. Okay, now we have laminated spherules with dystrophic calcification, which is seen in papillary thyroid carcinoma, meningiomas, mesothelioma, ovarian and endometrial serous carcinoma, and prolactinomas. These are psammoma bodies. Okay, so now we're going to be talking about some paraneoplastic syndromes that are associated with different types of cancers. So the first one is proximal muscle weakness, Gaucher papules, and rash around the eyes, and it's associated with adenocarcinoma. This is dermatomyositis. Next, we have hyperpigmented plaques in the armpit and neck, and it's associated with diabetes and cancer. This is acanthosis nigricans. Next, we have sudden onset of multiple stuck-on plaques on the skin and an underlying GI or visceral cancer. This is seborrheic keratosis, known as a laser trailat sign. So commonly when you age, you can get like one or two, a few of these seborrheic keratoses, but if you get a bunch all at once, then you have to look for an underlying cancer. Next, we have weight loss, cough, long smoking history. Labs show elevated calcium and an elevated PT-HRP. This is hypercalcemia due to squamous cell lung cancer. Next, we have weight loss, cough, long smoking history in a patient who has a buffalo hump on the neck and striae on the abdomen. This is Cushing syndrome due to small cell lung cancer. Next, we have a patient with weight loss, cough, long smoking history, and labs show hyponatremia, low sodium. This is SIADH due to small cell lung cancer. Now we have weight loss, cough, long smoking history, proximal muscle weakness due to antibodies against the presynaptic calcium channels. This is Lambert-Eaton syndrome due to small cell lung cancer. Now we have fatigable muscle weakness due to antibodies against postsynaptic acetylcholine receptors. This is myasthenia gravis due to thymoma. Now we have weight loss, cough, long smoking history, and the patient has neurological issues like memory, speech, psych disturbances, and anti-Hu antibodies are present. This is encephalitis due to small cell lung cancer. Now we have elevated erythropoietin in renal cell carcinoma, hepatocellular carcinoma, pheochromocytoma, or hemangioblastoma. This is polycythemia. Now we have anemia with low reticulocytes. This is pure red cell aplasia from a thymoma. Now we have recurrent, painful, red cord-like lesions along the veins that come and go in different areas of the body. This is migratory superficial thrombophlebitis, also known as Trousseau syndrome, from pancreatic cancer. Thank you so much for watching the video. Please feel free to reach out if you have any questions. Like always, please subscribe to our channel, like the video, share this with all of your med school friends, and we look forward to seeing you in the next video. Good luck studying, everyone!